It's Kevin Horan time again, and we're here today to talk about the healthcare reform. But let's face it, and before I go any further, let me give a shout out to Brett Keene. If you can put this on your channel if you like, if you think it's any good. But today we're going to talk about healthcare reform, some of the things that go into healthcare reform, and what I'd like to do is first give you a little bit of background. I've been in the health insurance industry. I've worked for Medicare supplement programs. I've worked for small group health insurance companies, and what I've seen over the years is care has been withheld, care has been rationed, care has been left to bureaucrats. This is all happening in today's healthcare system, but it's not really about healthcare reform. It is about health insurance reform, because healthcare is up to the doctors, nurses, and other medical professionals that provide the care. That's not going to change one bit. But what is going to change is how it's paid for and how it's approved. As I said, we've had healthcare rationing. We've had people who have been stopped out of insurance. We've had lots of things in that respect. What I can tell you is Medicare and Medicaid government-run programs have been working just fine for over 40 years. Ask any senior, they're not going to say they don't like the Medicare. Ask anybody on Social Security disability, and they're going to tell you they don't mind their health care coming from the government. These are things that happen on a regular basis. There are 50 million Americans who are not able to buy insurance, whether it's because they can't afford it, which is certainly some of those people. But many of those people are people that have had cancer, heart attacks, strokes, even high blood pressure, alcoholism, things like that, that the insurance companies now say, no, we won't insure you. The only way for those type of people to get insurance is to go ahead and either pay a crazy high premium, which they can't afford, or to go to work in a job that may not fit their talents so that they're able to get health insurance. Now that's a pretty crazy way to choose a job based on the healthcare availability, but I can tell you there's millions, and maybe tens or maybe hundreds of millions of Americans who are doing just that. The health insurance reform is not going to affect people who already have insurance. If you have great insurance through your union, because you're a member of the government, because you're an educational person, and you're getting your insurance through your job, that's not going to change. Why are people so scared? They're scared because they're being fed a bunch of lies by people who are backed by the insurance companies and the big pharmaceutical companies. Why Americans would ever believe something that comes off of FAW News, or you may prefer Fix News, or you may prefer Clusterfucks News, is beyond me, but yet 50 to 60% of their viewership believes the garbage that are spewed by the fearmongers that perform on this channel. Town hall meetings where people are shouting out, we should just close down those town hall meetings. And you know what? The Democrats need to develop a spine and say, this is what we're doing. We're going to ram it through. We have the majority. You're not going to filibuster. And we're just going to go ahead and get this thing passed. It's past time for bipartisanship. It's past time for 50 million Americans who don't have health care or affordable health care. It's high time for the private sector to, the government to become involved in a public option plan that will provide insurance to the many Americans that need it and want it, but just can't afford it right now because, or they don't qualify. Many people pay insurance for 20, 30 years, then they have one problem, and their insurance rates go up so high that they're forced to cancel it. This is garbage. This is bunk. This doesn't need to be happening like this. So what you need to do is to get in touch with your Congress people and tell them to develop some backbone. if they're a Democrat. If they're a Republican, you need to tell them what is your problem with providing basic health care to the citizens of this country who pay your salaries. Stay tuned tomorrow for more.